Hey guys, welcome back to Film Title. Today we'll talk about the most nauseating moments on Dr. Pimple Popper. Let's head into it. Number 1. Scooping out a shoulder cyst. Dr. Pimple Popper is well versed in a variety of surgical instruments, ranging from scissors for snipping lipomas to blades for cutting cysts. Celebrity dermatologist Dr. Sandra Lee used an unusual equipment on Monday night's edition of her show, a spoon. That's because she was tasked with treating Marty, a 51-year-old man with a 30-year-old epidermal cyst on his shoulder that had already burst. Marty admitted that he had considered bursting the cyst himself throughout the years, but had never consumed enough tequila to do it. Marty explained, "It's simply that I don't know how deep I need to cut it." An epidermoid cyst is a form of cyst that develops when skin cells burrow and grow beneath the skin. They usually grow slowly and are not unpleasant. Marty's cyst, however, exploded a few days before he could see Dr. Pimple Popper, and the cyst's contents hardened on top of the skin, making it difficult for Lee to determine where the growth began and stopped. Lee used the spoon to scoop out the remaining pus without damaging Marty's still intact skin. Dr. P compared the substance to creme brulee and flan afterward. She informed Marty, "I might have to name the spoon after you." Lee's plan didn't go off without a hitch. Marty kept grunting and squirming around throughout the treatment, giving Lee the impression that he was stressed or in discomfort. As a result, for the first time in history of Dr. Pimple Popper and Lee's profession, she allowed a patient to smoke outside during a procedure. Lee was able to finish removing the pus and sew up the wound, so it could cure once he returned. Marty, on the other hand, never returned for a second visit. Marty hasn't been seen in almost 3 months. I haven't been able to contact him, but I'm assuming he's fine with the cyst growing back and is celebrating with tequila somewhere.
This is the biggest cyst that I've ever seen. This is the standing world record of Dr. Pimple Popper's biggest cyst.
Number 2. Pebble-sized nodules and inflamed eyebrow cyst. Dr. Sandra Lee healed a 25-year-old man with a rare genetic disease that left him with painful, uncomfortable, and bleeding-prone lumps around his nose and eyes. On this week's episode of our TLC show, Dr. Pimple Popper, Juan from Tustin, California, came to Dr. P after many doctors failed to treat his genetic ailment, tuberous sclerosis, with inadequate topical creams. Tuberous sclerosis causes growths both within and outside the body, which can lead to various issues such as cognitive difficulties, cardiac problems, and epileptic seizures. He stated that his first seizure occurred when he was 6 months old, and he has been on a seizure medicine since he was 10. That's when the benign skin growth started to appear, he explained. They started out as freckles, but later evolved into lumps that bled at random intervals. "I don't want to go out with people because of my condition," Juan said, adding that he believes his skin growths are preventing him from pursuing his aspirations, such as attending film school. When Dr. Pimple Popper met Juan, she explained that experts don't know why some tuberous sclerosis patients develop skin growths. Lee began by numbing Juan's silver dollar-sized lump at the end of his brow. She then cut a small incision in the growth using a little surgical blade. She peeled apart the incision with scissors, revealing a pink bubble beneath. Despite the fact that the development appeared to be a cyst on the exterior, Lee said she had to be extra cautious due to Juan's condition. After gently squeezing the mass, white pus squirted out, confirming that it was a cyst, a type of growth that forms when a thick material, when skin cells or oil become trapped beneath the skin. Dr. P moved on to the lumps around Juan's nose, after stitching up the cut she made near the corner of his eye. Angiofibromas are little non-cancerous papules that form near the nose and are prone to bleeding. Dr. P employed another cauterizing tool to treat these growths, which both halted the bleeding and clipped the tiny nodules off the skin. The surgery was straightforward, but it was also nasty, and Juan kept coughing as a result of the unusual odors produced by the procedure. "When I cauterize tissue, it produces a small amount of smoke, which is actually vaporized tissue," Lee explained. "The aroma reminded me of getting her hair caught in a hair dryer, but according to Juan, the scent was worth it and was happy with the end outcome. The nose growth removal didn't require any downtime or stitches. Now that I have this clear, it will give me confidence to pursue my dreams," Juan stated.
Cysts are predictable yet unpredictable. Is it liquid? Is it solid?
This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.